This video introduces the stability evaluation test, referred to as the SET protocol. The SET protocol provides objective analysis of a patient's functional balance control based on the individual's postural sway velocity during 6 testing conditions. The SET is based on the Balance Error Scoring System, or BESS protocol, developed by Kevin Guskowitz at UNC Chapel Hill. SET measures a patient's functional balance and utilizes an objective measure of sway velocity. Balance is a key component in everyday life and vital to safe participation in sports. Balance is particularly critical when executing rapid, well-defined movements in changing direction, speed, and body position. If balance is impaired for any reason, patients, particularly athletes, are at increased risk of injury. The testing conditions utilized by the SET protocol are divided into firm conditions, those performed directly on the force plate, and foam conditions, those performed with a foam pad on top of the force plate. Both conditions test the patient with feet together, in single leg stance, and in tandem stance. Test time is 2 minutes divided into 6 20-second protocols of 1 trial each. With instructions, the total time to complete the test is approximately 5 minutes. The following video demonstrates the SET protocol, a detailed explanation of the analysis, and the interpretation. Finally, this video will conclude with answers to frequently asked questions about SET protocol. We are now ready to perform the SET protocol, the stability evaluation test. I have my patient pulled up in the system. From the assessment menu, I'm going to click on Stability Evaluation Test, and then continue. You'll notice that some important instructions appear on the screen. It's always critical to read all of the instructions on the screen before performing any of the tests. I need to make sure that I know which of my patient's legs is his non-dominant leg. When you go to kick a ball, which leg would you normally kick with?
With my right one.
The right leg. So that means that his right leg is his dominant leg, but we want to perform our tests on the non-dominant leg or the left leg. So I'm going to remember that his left leg is his non-dominant leg, and the system is going to prompt me to choose his non-dominant leg. I click on left and OK. And now we are ready to start the SET protocol. What I'd like you to do is stand right in the center of the force plate. And I'd like you to come a little more to the center. Great. Put your feet next to each other so they're touching. Great. For condition 1 of the SET protocol, we have the feet side by side touching so the base of support is narrow. I'd like you to put your hands on your hips, and this test is going to be performed with your eyes closed. When you're ready, I'm going to have you close your eyes and stand as motionless as possible. It's very important that the patient understand we want him to stay still as he can during the test. Are you ready?
Ready.
Okay, when you're ready, close your eyes. His eyes are closed and I'm clicking on the start button. This is a 20-second trial. I need to be sure that my patient is safe and that he understands his job is to stand as still as he possibly can. The computer will let me know how far along we are in that 20 seconds. We're almost done. All done, open your eyes. Great, perfect. You can relax now. We can let our patient relax between trials. The next condition is single limb stance with eyes closed. This is a task that is very challenging. Most people don't practice standing on one foot with their eyes closed. It's a new task. So before we test, we want to give our patient an opportunity to practice. So I'm going to have you stand on your left foot and balance with your hands on your hips. Good. When you're ready, close your eyes and this is just for practice. And his eyes are closed, and I'm watching to see how he performs. Open your eyes when you feel uncomfortable. Great. For safety, it's very important to let the patient know that if he feels unstable, that he should put his foot down or open his eyes. We don't want him to fall and injure himself during the test. Okay? Are you ready to try the test?
Ready.
Great. So balance on your left foot. Keep your hands on your hips, and when you're ready, close your eyes. His eyes are closed, and I hit the start button. And he opened his eyes, and he wiggled a little bit on the force plate. I stopped the test. The computer will not know if he makes an error, if he puts his other foot down, if he moves around, gets his hands off of his hips. It's my job as the operator to make sure that I am inputting any of those balance problems and stopping the test. Here I have the option to mark the trial as a fall or to discard the data. I am going to discard the data for this one and have him try it one more time. I click on the discard data button, and when he's ready, I'll start it again. Balance on your left foot, close your eyes. Hit the start button. And you can see even after a brief practice, he's more stable for this trial. You're about halfway there. Doing great. He's fighting for it, which is what we see many athletes do during this test. Oh, that was great. You were just barely under the 20 seconds. That was wonderful. So I am going to mark this trial as a fall. What you'll notice about this stability evaluation test is that a fall is not necessarily a fail because the computer has measured the length of time he was able to balance. These conditions are very challenging, and even normal individuals can lose their balance on these conditions. Okay? I have a message on the screen that says you can reposition your patient. Anytime you mark a trial as a fall, you have the opportunity to make sure your patient is repositioned for the next trial. I click on OK. Our next trial is tandem stance on a firm surface. So I'm going to have you stand with your feet in a line, left foot behind, right foot in front. Great. And hands on hips again. And I'm going to give you a practice trial. Go ahead and close your eyes. I'm making sure he's safe. If you feel unsteady, just open your eyes. Great, open your eyes. I can already see that he's more stable in this condition. We're going to go ahead and run the test. Are you ready?
Ready.
When you're ready, close your eyes. And I start the test. It's a 20-second trial. I'm making sure he's safe. If you feel unsteady, just open your eyes. And he's making adjustments. And he opened his eyes. So I'm going to, again, discard this data and give him one more trial. Tandem stance, eyes closed. Great. And we're starting. And he's much more stable in this position. Over halfway there. Doing great. And open your eyes. Good work. Go ahead and relax. And now I'm going on to the next trial, which is going to be with the foam Airex pad. Conditions 4, 5, and 6 on the SET protocol are identical to conditions 1, 2, and 3. The only difference is that we are going to do the next 3 conditions on a foam pad. What we've done is we've placed a non-slip surface underneath the foam. This is essential for safety. We're now going to do the same thing we did in condition 1. You're going to stand on the force plate, on the foam, with your feet right next to each other. That's great. Your hands are on your hips. Now that we've added the difficulty of the foam pad, I don't expect that he's going to be as stable as he was during the first 3 conditions. Are you ready?
Ready.
Okay, when you are ready, close your eyes, and I click the start button. And I want to be sure he's safe and stand as motionless as possible. You'll see that he is swaying more than he did on condition 1. This is expected because we've added the difficulty of the foam pad. Almost done, and open your eyes. Nicely done. Okay. We are now ready to move on to the single limb stance on the foam. This is condition 5. This is very challenging condition. Many normal individuals will lose their balance on this condition. What I'm concerned about is for your safety. If you feel like you are losing your balance, please open your eyes or put your foot down. Okay? You're going to balance on your left leg, hands on hips, as motionless as possible. When you're ready, close your eyes. His eyes are closed, and you can see that he's unstable, and he opens his eyes and puts his foot down. We're going to try one more time. I want to be sure that you have adequate practice before we collect the data. So for this, I will discard the data, and we will do it again. Okay, balance on your left leg. When you're ready, close your eyes. His eyes are closed, and again, he loses his balance. And this is a very challenging condition. Even normal individuals lose balance on this condition. I am going to mark this trial as a fall, and I get the prompt to position my patient before starting the next trial. The last trial in the SET protocol is tandem stance on the foam. I'd like you to stand one foot directly in front of the other, left foot or the non-dominant foot behind, hands on hips. How you doing?
Yeah.
You good? I'm going to have you stand as motionless as possible. We're going to do a practice first. Close your eyes. If you feel unsteady, open your eyes. Yeah, It's okay. Get centered again. One more practice, eyes closed. Very good, open your eyes. Okay, so what we see in athletes very commonly is they make adjustments and they fight to keep their balance. That's expected. Okay. When you're ready, close your eyes. And I hit the start button, and he's fighting, 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 fight for it. Go, good work. Good, that was good. You were fighting, and that was exactly appropriate. We'll do one more trial of this, okay? I'm going to discard that data. Try one more time. Tandem stance, hands on the hips with the eyes closed. And I've started the test. That's it. Hold on to it. Hold on to it. Fight, fight. Okay, good. I've stopped the test, and I'm going to mark the trial as a fall. At the end of the test, I get a prompt that asks me, all trials have been performed. Do you want to close this test now? I click on yes. I can put a comment into the comment box. For example, if he felt any pain, I could add a comment about pain. If he felt any symptoms of dizziness or headache or nausea, I would put all of that into the comment field. And then I click on OK. And I have completed the SET protocol. Now that the test is complete, it's time to analyze the results. This is an example of a SET protocol report generated by the Balance Manager software. This section of the video will review what each data section on the report represents, as well as how to interpret the results and determine the next steps for patients with impairments. The information provided by the SET protocol is designed to help the clinician assess the need for further testing in patients with signs and/or symptoms related to balance dysfunction, and also to establish objective baselines for preseason concussion screening, medical management, and outcome management. The results of the SET protocol are presented in graphical form. The The 6 boxes represent the center of gravity, or COG traces, for each condition. The circle in the center represents the normal sway excursion expected for each trial. The gray shaded area on each graph represents the normative data range. Green boxes indicate performance within the normal range. Red boxes indicate performance outside the normal range. A numerical value is given at the top of each bar. Clinicians have the option to mark a test as a baseline or to compare current results to a previous baseline test. What are the parameters for each of the 6 conditions? In condition 1, the patient is standing on a firm surface, eyes closed, hands on hips, with feet together. This is the easiest condition. The patient must use somatosensory cues to maintain stability and limit sway. Abnormal scores on this condition are rare and should be interpreted with caution, as this test is the same as the non-computerized Romberg, which has been shown to be insensitive to changes in postural sway after mild injury. Condition 2 is single leg stance on the non-dominant leg on a firm surface with the hands on the hips and the eyes closed. The patient must use somatosensory cues to maintain stability and limit sway. This test decreases the base of support significantly and reduces both the patient's sensory input and motor output. Many normal patients will lose balance on this test. As postural sway increases, the vestibular system becomes more active in participating in postural correction. Abnormal scores on this condition may indicate ankle stability in any direction, sensory integration problems, or inability to generate a more effective counterbalancing strategy due to orthopedic limitations or pain. Condition 3, the patient is standing in tandem stance on a firm surface with the hands on the hips and the eyes closed. The patient must use somatosensory cues to maintain stability and limit sway. The patient's base of support is significantly narrowed with tandem stance. As postural sway increases, the vestibular system becomes more active in participating in postural correction. With the feet in tandem stance, anterior-posterior instability can be corrected more readily than medial-lateral instability. Many normal subjects will lose balance on this test. Abnormal scores on this condition may indicate ankle instability primarily in the medial-lateral direction, sensory integration problems, or inability to generate a more effective counterbalancing strategy due to orthopedic limitations or pain. Conditions 4, 5, and 6 on the SET protocol are the same as conditions 1, 2, and 3. First, feet together, then single leg stance, and then tandem stance, all with hands on the hips and the eyes closed. But in conditions 4, 5, and 6, the patient is now standing on an unstable surface. Conditions 4, 5, and 6 on the SET protocol utilize the Airex foam pad on top of the force plate. Condition 4 is double limb stance, or feet together, hands on the hips, eyes closed on the Airex foam pad, which is an unstable surface. The patient must use vestibular cues to maintain balance with absent vision. Somatosensory cues are altered by the instability of the foam pad. The feet together stance for this condition gives the patient a biomechanical advantage. Abnormalities may implicate sensory integrative impairments, although biomechanical factors contributing to the impairment may not be ruled out. During condition 5, the patient is tested on the foam pad in single limb stance on the non-dominant leg. The hands are on the hips and the eyes are closed. The patient must use vestibular cues to maintain balance when vision is absent. Somatosensory cues are altered by the instability of the foam pad. The patient is biomechanically disadvantaged by the significant decrease in the base of support when in single limb stance, therefore increasing the challenge to both the sensory input and motor output systems involved in postural control. Even normal individuals can lose balance on this condition. If the condition is abnormal, sensory integrative impairment as well as lower extremity biomechanical impairments should be considered. Condition 6 requires the patient to assume tandem stance on the foam pad, placing the non-dominant leg behind. The hands are on the hips and the eyes are closed. The patient must use vestibular cues to maintain balance when vision is absent. Somatosensory cues are altered by the instability of the foam pad. The patient is biomechanically disadvantaged by the significant decrease in the base of support when in tandem stance, therefore increasing the challenge to both the sensory input and the motor output systems involved in postural control. Even normal individuals can lose balance on this condition. If this condition is abnormal, sensory integrative impairment as well as lower extremity biomechanical impairments should be considered. After completing the full set protocol, the clinician has the option to store the information as a baseline for the patient. On subsequent tests, clinicians can compare new results against stored baselines. Storing a test as a baseline test is as simple as selecting the box labeled "Mark as Baseline." This test will then be used as the one for comparison to future assessments. To compare a test to the designated baseline test, select the box Compare to Baseline. The chart shown displays possible care plans based on outcomes of the SET protocol. Finally, I'd like to address frequently asked questions about the SET protocol and the benefits of objective balance assessment when making return to play decisions after concussion. Why is balance important to an athlete? Balance is a key component in everyday life and vital to safe and successful participation in sports. Balance is particularly critical when executing rapid, well-defined movements to change direction, speed, and/or body position. Optimal balance performance is critical to preventing injuries, both on and off the field, and must be evaluated when making return-to-play decisions after an injury. If balance is impaired for any reason, athletes are at an increased risk of injury. Current best practice recommendations from the NCAA and NATA support a three-pronged approach based on symptoms checklist, standardized cognitive processing exams, and balance assessment. All three are required for making a return-to-play decision post-concussion. Does the SET protocol compare the athlete's performance to norms? Yes, the SET protocol is based on data gathered from 4 sites using an athletic population from 13 to 25 years of age. The mean age is 19 years and standard deviation of 2.3 years. That population was predefined as having normal balance control, as the subjects were actively participating in sports, not currently being treated for any neurological or orthopedic injury, had no recent history of concussion in the past 12 months, and were not currently under treatment for any of the same. A total of 380 subjects were tested. The scores for an individual athlete are automatically compared against that age-matched database. Can I compare the athlete's performance to their own baseline? Yes, however, there's also a reference database to compare the athlete's performance to their peers. Which is preferred, comparison to baseline or to the normative database? Published research has argued that the best indicator of changes in balance control is to compare individuals to their own baseline. With the SET protocol, the clinician can easily determine whether the athlete is progressing back to or better than their baseline SET scores, and/or how that performance compares to their peers. If, after an injury, the athlete's set protocol scores are normal or as good as their peers in the reference data set, but not as good as their baseline performance, they likely still have a problem. It is recommended that the athlete return to their baseline scores before returning to play. It is up to the clinical judgment of the athletic trainer to evaluate the total clinical picture and determine if, along with neurocognitive and symptom information, the athlete is ready to return to play. What is the significance of the composite score? The composite score quantifies the center of gravity sway or postural stability under each of the 6 conditions. Effective balance control is determined from the overall pattern of scores across the 6 conditions. The composite score, the average of the scores of all 6 conditions, characterizes the overall level of balance performance. Do I have to do all 6 conditions to get the composite score? Yes, the test has been designed to allow the clinician multiple trials in different positions to identify postural instability. This redundancy increases the reliability of the test and increases the chances of identifying subtle impairments. This process will help increase the safety of the athlete as return to play decisions are made. Why is SET preferred for the athletic population versus the modified CTSIB? The modified CTSIB was developed originally for the elderly population and is not considered to present a sufficient balance challenge to an athletic population. If the SET scores are outside the normal range, what do I do next? If the athlete's scores are abnormal, your clinical judgment will help determine appropriateness for play and the need for further medical follow-up. The SET protocol score, along with symptoms and neurocognitive scores, may drive clinical decisions recommending further assessment and treatment. Does a fall on the SET protocol always equal a fail? A fall on the SET does not always equal a fail. When conditions are very challenging, such as in conditions 5 or 6, many normal individuals have difficulty maintaining balance for the entire 20 seconds of the trial. A fall during these conditions may be scored as normal performance based on data from sway velocity measures as well as the length of the trial. The Balance Manager system is measuring both sway velocity and the length of the trial, calculating the score based on both components. How does the SET protocol compare to the BESS, Balance Error Scoring System, and to the Sideline Sport Concussion Assessment Tool, also known as the SCAT? The BESS, the Balance Error Scoring System, is a valid observational method designed to assess balance control in athletes in the absence of standard objective measures, such as the Sensory Organization Test, the SOT, or the Stability Evaluation Test, the SET protocol. The BESS is a non-computerized subjective assessment scored by the number of errors counted by the clinician. The SCAT is a sideline assessment incorporating 3 key components for injury assessment: symptoms, neurocognition, and balance control. SCAT is used to make fast, immediate return to play decisions. As this assessment is often completed on the sideline, performance and scoring are susceptible to environmental distractions. The scoring of the SCAT, by definition, is subjective.